actually use. Today, we're diving into surgical science, some really interesting updates that could change how surgery happens, making it safer, maybe more specific for you.
Yeah, so our deep dive today, it's based on a scholarly review, a critical summary actually, of two recent articles, both from BMC Surgery, the 2025 volume. One's looking at subcutaneous fat thickness and infection risk after appendectomies. The other is about pilonidal sinus recurrence in young adults. And this analysis, comparing them with other recent literature, it comes from Dr. Reza Lankarani, general surgeon and founder of the Surgical Pioneering newsletter and podcast series. We'll also touch on a related piece from the AME Surgical Journal on pain relief in esophageal surgery, right? And what these studies really drive home is how, our listeners got something to share.
Hear it.
Hi, this is Dr. Reza Lankrani, Surgical Pioneering podcast series founder. I just wanted to say thank you, and I really appreciate your work and your efforts through the medicine, and I look forward to see how it's gonna end. Hopefully.
Well, thank you so much for that kind message, Dr. Lankarani. It's an absolute honor to have you listening.
Wow, yes, a huge thank you. We truly appreciate your work and the insights you provide.
Your analysis is incredibly valuable, and it perfectly highlights what we're aiming to discuss today.
It's fantastic to know the founder of the series appreciates our efforts.
Right, and what these studies really drive home is how specific patient factors, individual factors, are playing a huge role in surgical outcomes.
Yeah, it's pushing us definitely towards more personalized care.
More effective care, hopefully.
Okay, let's dig into that first one then, the appendectomy study.
Association between thickness of subcutaneous fat and incisional surgical site infection.
What's the bottom line here?
Well, it's quite fascinating, actually. This is a big meta-analysis. 9 studies, 4,439 patients involved. They found a pretty significant link. An increase in subcutaneous fat thickness, or SFT, was associated with an increased risk of SSI.
So quite a difference. Does that directly mean, a higher risk if you have thicker subcutaneous fat?
Absolutely. The pooled odds ratio was 1.32, meaning about a 32% increased risk.
Okay, so nearly a third more risk. Wow.
Exactly. And interestingly, when they looked at how the surgery was done, the link was stronger with open appendectomy.
Right, okay.
The risk was about 1.82 times higher with increased SFT for open procedures.
Compared to laparoscopic, which was still higher risk, but not quite as much as open.
Precisely. For laparoscopic procedures, the risk was 1.09 times higher, which means it wasn't statistically significant in that group.
That makes sense. So what does this mean practically in the clinic, in the OR? How does this help?
Well, it gives surgeons a practical number to think about. It suggests that, maybe we should be measuring or estimating SFT beforehand.
It's like a warning flag.
It could guide decisions, maybe using different antibiotic strategies based on risk, or specific ways to close the wound.
Particularly if it's an open procedure, so tailoring the prevention based on the patient's own body.
Precisely. It's personalized risk management, basically, using your anatomy to guide your care.
That's a really practical takeaway, using a simple measurement like that.
Indeed, Dr. Lankarani's summary really emphasized this as a key actionable threshold for clinical use.
Okay, let's switch gears. The second article, Pilonidal Sinus Recurrence Rates in Young Adults.
This sounds like it's all about picking the right surgical technique.
It is, very much so. This was a retrospective look at 412 young adults who had surgery for pilonidal sinus.
They found an overall recurrence rate of 14.3%. This was at a median follow-up of 28 months, so pretty decent follow-up time.
14% overall, but I guess the technique really mattered.
Immensely. So for what they call primary closure, just stitching it up directly, the recurrence was high, 22.2%.
Oof, yeah.
But then you look at the flap-based techniques. These are more complex, rearranging tissue.
The Limburg flap had a 9.2% recurrence.
And the Bascom cleft lift technique does the best, only 6.2% recurrence.
Wow, 6% versus 22%. That is a massive difference.
Were there other factors involved besides just the technique?
Yeah, they looked at that too. The multivariate analysis confirmed primary closure itself carried a 3.1 times higher risk of it coming back.
And also a BMI over 28, so higher body weight, that was linked to a 2.4 times higher risk.
Okay, so technique and patient factors again.
Right, and there's a trade-off here, which is important. Primary closure, despite the high recurrence, it healed fastest about 3.2 weeks.
The Limburg flap took longer, like 6.8 weeks to heal.
Ah, I see. So faster healing, but much higher chance of needing surgery again later.
Exactly. The lower recurrence with the flap techniques really argues for their long-term benefit.
Even with the slightly longer initial recovery, It's a key discussion point with the patient.
It really connects back to that first study, doesn't it? Patient factors like BMI here and the choice of approach are just critical.
And even that third topic you mentioned briefly, the Amy Surgical Journal one about pain control after esophageal surgery.
For vertebral versus epidural analgesia, it just reinforces this whole theme, right? Even managing post-op pain isn't one size fits all. It depends on the surgery, the patient.
Absolutely. It all points towards this idea of precision surgery, optimizing everything around your specific needs and risks.
So reflecting on this deep dive, what really stands out to you?
For me, it's how these findings give surgeons, actionable data, things they can use to tailor treatment specifically.
Yeah, I agree. It really exemplifies that shift. We're moving away from just general protocols
towards using individual anatomy, individual risk profiles to make better decisions during and after surgery.
It means better outcomes tailored to you.
And it reminds us there's always more to learn,
Looking at these comparative analyses, like the one Dr. Lankarani provided, it really enriches our understanding.
Definitely. And this episode, as we mentioned, was provided by Dr. Reza Lankarani, general surgeon and founder of Surgical Pioneering newsletter and podcast series.
If you want to dig into more details, you can check out the Surgical Pioneering podcast series application. The link is https.surgicalpioneer.co.x.m.